Hi, everyone. Thank you, guys. So, when you go to a hospital, you expect to heal. That's not always the case. Some buildings are actually making us sicker. Sarah Fortune talked about the outbreak of multi-drug resistant tuberculosis, and I'm looking at the spaces of where those outbreaks are actually happening. In Tugela-Ferry, South Africa, in 2005, the first outbreak of extremely drug-resistant tuberculosis emerged, and every patient that got it died. It turns out that one of the reasons they died is because the spaces of the hospital themselves was not designed to deal with this disease. This is a crisis. And what's the solution? Fortunately, it's not some insane thing to purchase, some crazy new building. In fact, the solution is something quite easy. It's just thinking about how we design buildings to heal instead of how buildings can actually make us sicker. I had this opportunity to work in northern Rwanda as an architect on this hospital, which just opened in January, which we're pretty psyched about. In this hospital, we took it as a challenge to think about how can we design a space that actually helps to reduce transmission rates instead of incubate or cultivate drug-resistant strains as well as transmit diseases themselves. Some very simple things to think about. If patients are waiting in hallways where they weren't meant to be waiting, why not design a hospital without any hallways? Make patients go in the exterior, which we might call ultimate air mixing. The other thing is when they are waiting together, why not use a sort of design that we can use just natural ventilation alone? The magic number is 12 air changes per hour. Can we get 12 air changes per hour by using just natural ventilation? Working with the Harvard School of Public Health and Harvard Medical School, we found out that we could. Especially in northern Rwanda, where there's a great topography, great airflow, we were able to use a sort of series of redundant systems to get that air change per hour. So this is a hospital that can actually reduce infections. But the other thing we learned is that it's not just about how the building functions, that the architectural strategies have to also think about how it can improve lives in other ways, particularly in the process of building. This is a story I want to tell you about the way in which we built this. This is a typical stone wall in Rwanda. It uses this beautiful volcanic rock. But the way it goes together is with a lot of cement. You can barely even see the stone. When we went about building this building, we wanted to sort of isolate and highlight the beauty of that stone, that really beautiful stone, and sort of talk about the materials of this community. So we had a couple masons there on site, and we asked them to do a kind of mock-up of like a stone wall that we wanted to put together, something that would have kind of no mortar or no cement that we could see. Sort of like a jigsaw puzzle design. They did one mock-up. It was okay. There was a lot of mortar in it. They did another mock-up. 10 mock-ups later, they finally got something that we were really into. And as you can see, this is the stone wall of the hospital. And when they started on that corner, they started working on that stone wall. It's about a 25-foot tall wall, and they wrapped around that whole building. And by the time they got back to the same corner they began, they were so good at putting this wall together, this stone, and like hand-cutting it on site, that they asked if they could tear down the original wall and rebuild it with their new skill. This is that wall, as you can see. And you can also see that this is a space where we have no glazing, so you're having all this airflow through this. We also have a kind of stacked ventilation in that space as well, so you're getting that kind of airflow. This told us something, not just that buildings can function better if they're designed well, but they also can affect community in significant ways. The question really is what is going to happen if we don't do this, right? What happens if we don't think about architects involved at the beginning stages of the design of facilities that are at the forefront of the transmission of new global pandemics like TB, like Sarah was talking about. This is a picture, of course, from Haiti after the earthquake. And as we know, people were asking this very question after the earthquake. Finally, they're asking this question because it's not the earthquake that killed 200,000 people. It's the buildings that fell on those people after the earthquake that killed 200,000+ people. So I'm going to leave you this series of questions. This is the future of architecture. How many people would it impact if we actually required our buildings to give jobs to only the community around us? What economies could we create if we used only the materials that we found locally or on site? How would buildings look if they only responded to the climate and the very landscape that was around that building? And finally, what if the buildings that were making us sicker were actually designed to make us better? This is the future of architecture. It's happening now. It's happening in Rwanda. It's happening elsewhere. And this is the kind of buildings that can make us heal. Thanks very much for your time.